Good morning, Your Excellencies. Welcome. Thank you for being present. Soga, Mr. Theo Cole, and Mr. Viller also. I would like to introduce myself. My name is Selena Goedhoop Cruz. I am from AIB Bank, and I will be your Master of Ceremony this morning. Together with this, I would like to introduce now Mr. Franz Regier, the Managing Director of AIB Bank, to start the opening of this ceremony.
Excellencies, Prime Minister of Aruba, Mike Eman, Minister of Public Health, Minister Alex Rangel, Minister of Infrastructure and Planning, Minister Benny Zievinger, the Board of SOGA, OHL Arellano representative, Mr. Willie Bermero of Bermero Agamil and Partners, the Management Board of the hospital, the Board of SOGA, representative of the lenders, distinguished guests and the media, welcome this morning to this special occasion. When he says special occasion is that we have embarked on this process, on this project, about 3 years ago. We have been invited to take up this project and sign an MOU on 27th of June 2011, and we have reached to this stage today, and we're very pleased with that. In order to, I'd like to provide a background of what SOGA stands for. SOGA is an institution, an initiative by the General Pension Fund of Aruba, who have invited the AIB Bank in 2005 to join them in instituting a special purpose vehicle whereby they can place their funds, because there are requirements from the local regulators that 60% of their premiums have to be invested locally. So they were looking actually for a vehicle whereby to invest long term. And the other side, the government had needs for public buildings, suitable public buildings, and that can be kept well maintained. So we have went to the drawing board as AIB Bank. AFA invited AIB Bank to be partnered into this process. We instituted a special purpose vehicle, which we are standing today, are taking this project. The first project we took was the 16,900 square meters construction of three new buildings, and we are maintaining them well. We are operating, and it's being used by the user, Belastingdienst, public works departments, and ATA. We have reached this milestone after reaching a number of process in the process of engaging in the SOGA hospital project. On February, we signed an A&E contract whereby our architect have engaged all stakeholders to participate into the process of providing their needs for the expansion and renovation of the hospital. Thereafter, we signed a program of requirements with the hospital and the stakeholders, and after that, the Parliament was approached, whereby a lease agreement was signed. So we are very happy that we were able, as a bank institution, to engage 18 financial institutions in the region, Aruba and international, to participate and show their trust in this interesting large projects. We are pleased that they have showed their trust in Aruba as well, and we thank also all the stakeholders that have on the table here, the architect, the contractor, primarily the government of Aruba that have entrusted SOGA with this large project, and also the hospital for being the player also, the operator, and provided also their requirements. We want to congratulate Yamadanki to the public of Aruba, Pabien, and we would like to see in the coming 2 years the new tower and an MOB building, and thereafter the current hospital to be renovated. Thank you very much.
Thank you, Meneer Giel, for your nice introduction. I would like to call forward now Mr. John Hudson, Chairman of the Board of SOGA.
First of all, thank you, Frenzel. Frenzel and Jesse of the IEB Bank have been really a big backbone throughout this whole effort, and we really thank the bank as well as these two persons for their tremendous effort that they have put into this project. But I am pleased to be here this morning, and I'm really excited that we have reached the point after such a long time to be able to sign a contract with the selected contractor for this huge project, that is the renovation of the Dr. Horacio Audibert Hospital, as well as the expansion thereof. I'm really thankful to the Lord that He has enabled this all, and that we, at this today, really could sit together with all the parties and sign that contract. This is after many months of hard work, starting with, among others, the development of the concept, the engineering, discussions with the many stakeholders. And believe me, there are many stakeholders in this project. It's just not the hospital. Fundraising, as Frenzel clearly indicated, but also going through an elaborate tendering process to the point we reached today, the signing of the contract this morning with the selected contractor, OHL Arellano Construction Company. Our partner in this exciting project has been selected after a rigorous evaluation process, starting with 23 companies and ending with 2 contractors who really qualified. There were really 3, but 1 fell out. 1 withdrew. I must admit that the bid that we received were all much higher than we had expected. But the selected contractor was the best, and we jointly agreed, let's negotiate, let's see how far we can come. And I'm pleased that after much blood, sweat, tears, and turning arms, we reached the price which was not only close to our budget for the contractor, but it was really slightly lower than our budget for the contractor. So this was really a tremendous effort. And as I mentioned, this was not an easy task, but we thank especially not only Arellano, but the local subcontractors that Arellano has picked out. And because without their help and without their really working together with the team to bring the price down, this would not have been possible. So really, I would like you to give these local contractors a big hand. They really knew it. As far as OHL Arellano Construction Company is concerned, they're an international company, an experienced company, intimately familiar with building hospitals. This is nothing new for them. This is, as they say, a piece of cake. But working with them, for us, was a tremendous experience. Their staff is very pleasant to work with. They're very professional, but they're very cooperative. They have worked with us in a way that really is above our expectations. And their subcontractors, we invited them at a certain moment as we started the negotiations to a meeting in Miami, and they all attended. And as I mentioned, the way they helped to get that price down was above expectations. And once more, I want to thank them. So they have a good team of subcontractors working with them. So most of that work will be done just by local subcontractors. The plan is to start construction in May. I know people would like to start tomorrow, but they're going to start in May.
Afternoon.
This afternoon, okay. That's what. Okay, and it's going to start first with the expansion portion. That's, as Rangel mentioned, the MOB. We're going to have the 6-story bed tower, a new power plant building, and a number of other new construction that will take place. And this first phase will take about 2 years. They have promised us that they will be doing it faster, but 2 years is the deal. And after that work, the rest of the work will be the renovation of the existing hospital. I would like to thank the government of Aruba for selecting SOGA to carry out this project, and the good cooperation of their various departments as well as their advisors in moving this project forward. I would also like to thank the AEB Bank once more and their staff for managing the project and their good spirits throughout the high and the low times that we went with this challenge. It goes without saying that without some other folks behind us, this project would not go forward. So I would like also make use of this opportunity to thank the steering committee that has been with us from the beginning for all the effort they put in to really steer this project in the right direction. I would like to thank also the HOH staff, management and staff, for their being with us and for their participation in really going through all the drawings, going through all these documents. For them, it was something new, but they went through it and they're still struggling through it. But without that, you wouldn't be able to get a project that carries the support of all. So we had to go through that. And that may have stretched things, but it was for the good. I would also like to thank the architect of this entire project. That is Willie Bermelo, who is also here with us. He was the one that really started off with the initial design, and his participation and his cooperation during this entire project, even now, is really above our expectations. And I would like to thank Willie, he's sitting right here, for being here today. As Rangel also mentioned, of course, we need money to do this project, and we thank the lenders and all their representatives who are here for really pitching in and helping us to get the funds to carry out this project. There was also an outside consultant, BCQS, who assisted us with this project as an independent consultant, and would like to thank. Unfortunately, he's on vacation right now, but we would like to thank BCQS with this. There are many others. We are thinking of PIP, Polytechnic Engineers Bureau, and other consultants who helped us to reach this point. And really, without all these people, such a project is very difficult to move forward. In Proverbs, King Solomon said, "Finish your outdoor work and get your fields ready. After that, build your house." We now reached the point that we're going to build our house. Thank you.
Thank you, Mr. Hudson. And I would like to call now forward Mr. Frank Viller, the CEO of OHL Arellano Construction. Okay.
Good morning. I'm Julio Alberto Alia. I'm the
representative of OHL Group. I'm extremely pleased and grateful to be part of this project today and to become part of your community as well. I want to give thanks to SOGA because of the great collaboration and effort during these couple of months. And I want to give thanks to John for the kind word around our company. I think this project is going to promote healthcare condition and is going to promote job creation in the community. We are going to create a web page in order to promote these jobs, and we are very pleased to be part of this community and to collaborate with you guys in the future. I hope this project is going to be the first project in Aruba for us, but it's going to be part only of the other future opportunities. Thank you very much.
Thank you, Mr. Arthur Hellenic. With this, I would also like to call Mr. Theo Kool of the Management Board of SZA and HAOHA.
Good morning, everybody. Your Excellency Prime Minister, Minister of Public Health, Minister of Infrastructure, thank you for making it possible for us to be here today. I think this is a great moment for the hospital, but also for the whole island, because the hospital is here for the whole island. When I started working at the hospital 3.5 years ago, the hospital had just embarked on a new effort in preparing plans for a new hospital. Sometimes I felt bad about how long it took before we could actually execute something in terms of construction. But when I talked to people that had worked at the hospital for 20 years or longer, who explained to me that during their entire career the hospital has been engaged in preparing for renovation and expansion, I didn't feel so bad at all. I think it just underscores how big a day it is today. Thank you for that. I think it's very important. I think it's good to explain very briefly, don't worry, very briefly, what I think a hospital will become in the near future. You see a shift towards shorter stays. The quicker the patient goes home, the better it is, usually. We see a reduction in length of stay in the hospital, which is good for the patient, but also good for us. The best hospital is the one you don't use, from a patient perspective, obviously, not from an investor's perspective. And I'm very pleased to notice that about half of the patient visits that we get are day surgery and other one-day treatments already, when you compare that to regular admissions. That's a very good development. But it also requires a different approach in the hospital. We don't need as many beds, and we need other facilities. We need diagnostics facilities. We need exam rooms. We need better facilities for ambulatory care, for outpatient clinics, polyklinieken, or oficinas, as we say here. That's where we need to place the effort. That's why it's a very good feature that we have a new medical office building where the outside clinics will be specialized. I think that's very good. You see also a shift in the emphasis of hospitals towards patient experience. I think the quality of medical care that we provide in the hospital is already good, but it's now beginning to be hampered by the building itself. The building is old and it's very cramped. When we try to find spaces in our emergency department to put some computers, we couldn't find the space. It's that cramped, it's that busy. We hardly have any space, any adequate space for medication cabinets in the nursing departments. We don't have adequate space for doctors to work in the nursing departments. That's a real problem, and that's something that's going to be solved with this new hospital, this new building. This requires a new approach. We need to rethink the way we work with the patients. So this whole new opportunity of the building very nicely aligns with the strategic plan that we are developing. We have already presented the very first draft to the Minister of Public Health. We are in the process of discussing it with a number of stakeholders, and I think in a few weeks this plan will be finalized. That plan will help us change the way we work as a hospital and align it with the new opportunities that this building is going to create us. John Hudson already mentioned it in the House. In the parliamentary approval, the question was also asked, how are we going to make it a home? We are working very hard on that. We have 4 programs in the hospital that's basically a group of projects with similar purposes, similar objectives. One is obviously the quality and patient safety. One is the process optimization. How do we facilitate patients going through the hospital, reduce waiting times, be as efficient as a hospital as possible. The third one is education and development. Professionalism of our people is very important. And the fourth one is information and communication. Not only the hard part, the ICT part, but also the softer part, the communication to the patient. How to engage the patient in the whole curing process and caring process. That's very important. We feel that we need to train our people in that perspective. They want to be trained in that perspective. And I think with these 4 programs, we will be able to reach the objective that we have stated for our long-term plan. And that's become one of the best hospitals of the region. It is ambitious, but I think that's where our ambition should be. We have called the program Samen Beter, Hund om je hoop. I'm very pleased that it translates very well into Firmamento, but I haven't found a good English translation yet. It's something like better together or together better. I think it also applies to this whole project. I'm very pleased with the cooperation. I would like to thank Willy Bermello and Ariano very much for their patience in explaining everything that was new in this project, all the terms and concepts that we were not familiar with. Thank you very much for your patience. I would like to thank SOGA for their assistance, their commitment to the project. But last, certainly not least, I'd like the government to thank the government of Aruba to make this possible. I think this is a very important project, and we as a hospital, but most of all the staff that we saw in those slides, they're very committed to make this a really good hospital and one of the best in the region. There should be no need to go to Colombia or the Netherlands for good medical care, except when it gets very complicated. Thank you very much.
Thank you, Mr. Cole. Hereby, I would like to introduce our Excellency Minister of Public Health, Dr. Alex Rangel.
Morning, everybody. I would like to welcome the members of the press, of course. Thank you guys for being here. My colleagues of the ministry, Bermeo, Aramil and partners, Ariano and partners, SOGA, and of course also Infra team, and last but not least, HOH and the whole team. Well, indeed, the negotiations were quite intense. I was on the other side back then as a lung specialist, and I can tell you there is a need for a new hospital, but not only the building, but also the way we work. But the negotiations were intense and even sometimes hostile when we have really, really huge arguments about details, but also about money and about quality. But finally, we came to a point, and today we will sign the agreement. And this agreement will mark a new era. For me, especially also as a person, but also as a doctor, for me it's a new era for the healthcare with new opportunities for the healthcare of Aruba. With this remark, I mean that we are not just talking about getting a new medical building, but we are talking about the opportunity and the commitment we are making to better our healthcare system in its total for Aruba. And when I talk about healthcare, I also talk, and I always talk about quality, because this government has made a commitment more than 4 years ago that we are going to work on the quality of life of every citizen of Aruba. So the aim is, and it's an ambitious aim, of course, but I think that's the only aim for any government, that you should take care of the quality of life of your people. And by a better quality of healthcare, of course, this building can help us with it, because a new working area for the specialist, for the nurse, it will sensitize such a person to do his or her best better for the patient. But we will have to invest much more than just the building. We have to invest in a vision. And that's why I'm glad that Theo talked about a new vision document that the hospital just made, and they made it. They got some help from a consultancy, of course, but it's the idea of the people working in the hospital. And it's from the people, for the people. And this idea is about quality, taking care of our own. And not just in figures, but also in treatment. And it's in the name. The name van Dr. Horacio, a Oudenberg Hospital, the name is in there. It's about hospitality, being kind to your next, to your own, to your human being. So I hope this building will mean that. And I'm making the commitment, on behalf of the government, of course, that we are committed to take the healthcare to a new level. And there are certain specific things we should target, like the waiting time. So I'm making this commitment not only as part of the government, but I will need the help from my colleagues, doctors, nurses, primary physicians, and so on, because the waiting time on Aruba is not good. So we have to work on that. But we have to work also on how we approach patients. If you had a bad day, it's not the fault of the patient. You have to be caring, have patience, and you have to show that to your patient. Those things we have to work on. And I think it's really important too, and I will finish with that, and this is a commitment of the government too, and certainly my commitment. We have to be accountable for what we do, and we have to be more transparent. So I'm making the pledge, and I hope the ones working in healthcare will make the pledge with me, that we, from this day on, we will be accountable for what we do, and that we will be transparent for what we do. So that's my commitment to you guys, and I hope you can take the journey with us to take the new healthcare for Aruba to a new level. Thank you, guys.
Thank you, Minister of Public Health, Dr. Alex Rangel. I would hereby like to introduce Minister of Infrastructure, Mr. Austin Siefinger.
Good morning, ladies and gentlemen, everybody present here today. As mentioned, this is a special day, a very important day. We reach a milestone, and today is a very pleasant day to sign an agreement that we can start this project. It's all begin with a vision, and today we spoke about a vision. And if it was not for the vision of the government, and primarily for Prime Minister, I want to congratulate the Prime Minister for this vision in 2009. We sit together in the government, all the colleagues, and we said, we're going to make Aruba a better place. We're going to make Aruba a better place for our citizens and for the people who's visiting us. And in that vision, the quality of life was primarily the number one on the list. And it's with that vision that we start making projects for Aruba. It's not only the hospital, it's our barrios, it's our cities, it's our schools, it's our elderly homes, it's the renovation of Aruba as a whole product. And the hospital is one of those projects. The infra team, together with experts from abroad, Willy Bermelo is one of them, we have said we make a master plan for Aruba, and this is one of the projects on that master plan. So in 2009, we started with that vision, and today we reach a point that that vision is going to be executed in the building, in the construction phase of this one. It won't finish there, as my colleague Schwengel said, because you have a building, but now you need to make that building functional. People has to get the service. People has to get a better quality of service in the new hospital. But it is for the people of Aruba, and I'm very glad that, and congratulate the people of Aruba, that today we can start, not in May, this afternoon, we will start with the construction of this building. And I would like to congratulate everybody who worked on this project, because you can have the vision, but if you don't have people to go with you into that vision and reach and solve all the problems during the whole process of going to look for a partner, SOGA, going to look for the architect, going to look for the construction, reaching all the problems that you will encounter, going to the parliament, signing the long lease, going to the notary. There's a lot of things you have to do to reach this point. And reaching this point is just starting the construction. So we have 4 more years to go before we can deliver the key to the hospital so they can take from there over and then give the quality of service to our community. So I would like to thank all the people who worked in this project. We just start with the construction. It will have some problem during the construction, but I'm very pleased that the team we have, we can solve all those problems and reach over 4 years the renovation and the expansion of the Hospital Aruba for the better quality of our people and for the region of the Caribbean. So thank you very much. Congratulate to everybody and the public and the people of Aruba. Thank you very much.
Thank you, Your Excellency of Infrastructure, Mr. Oslin Sifinger. With no further ado, I would like to introduce our Prime Minister, Mr. Mike Eman.
Good morning, my colleagues, members of the press, ladies and gentlemen. Today, indeed, is a very important day for Aruba. We are not only creating a national commitment towards the building of a new hospital for Aruba, but we are also laying a stronger foundation under a vision for a better quality of life for our citizens. In 2006, I spent a couple weeks in the hospital of Aruba when my late mother was very ill. And during those weeks, we stood as a family very concerned, in very difficult moments, but we stood in a hallway. Day and night, there was no place for families to sit. And we live in a community and a country where you look out of the windows, you see 5-star hotels, and then you stand as a family in a hospital under the most difficult circumstances that you can have as a family, definitely when it's a situation with your mother that you don't have that kind of support for a family. And naturally, we are very satisfied with the medical treatment of our patients in Aruba, although we strive every day to make it better. If we compare it with the region, definitely we are one of the countries that can be proud of our medical service in Aruba. However, the provisions around it are not of the quality that we would like to have for our country. And it is during those moments that you don't only create an awareness, but you also create a commitment to change things that you feel that are not at the level that our society deserves. I'm sure many of you have been called also late in the evening that a family member or a friend is very ill or got himself or herself involved in an accident. I've been to the hospital in late hours in the evening, 2 o'clock in the morning, 3 o'clock in the morning, and then we stand together with a family that just learned that a member had passed away, and we stand under a tree somewhere at the Polyclinic. This in a country that we call a very developing country, and again, that stands at 100 meters from 5-star hotels. A society like that is not sustainable. A society where you have a few people that make a lot of money, and many that have very little income, a society where people work for a minimum wage in a five-star hotel and then go home to a neighborhood that doesn't have lighting, doesn't have pavement, bring their kids to school where the ceiling falls on their head, where there is no public spaces where they can enjoy also some of the recreational and valuable family time, is not a society that is sustainable. That was our commitment to change the course of this country, to have neighborhoods where our people can also have a quality of life that they deserve, to have schools, to have public spaces, and to have a sense of caring and sharing in the society that really everyone would support each other. That doesn't come only with a new building. It comes with a national commitment to create this other quality of life. It is not easy. It's much easier to build 10 more hotels in Aruba. I sometimes have to put triple locks on the door at my office to keep developers out that want to build another 10 hotels on the Eagle Beach or other beautiful beaches of Aruba. But find them to build something new or different, something creative, something that would expand the economic basis of Aruba, or would create a new service for Aruba or bring Aruba to the next level. That is a more challenging task. But by setting these standards that we are setting also as government, choosing this more difficult route, but definitely the best route for a sustainable society, I'm very sure that with all the efforts that we bring here together as a very important symbol of all the institutions in Aruba, the lenders that created the financial possibility for this project to be realized today, all the efforts within the hospital, the doctors, the nurses, the union, everyone that came together to give their contribution to make this hospital, this new hospital, possible. All the work done by the Minister of Infrastructure with his infra team, all the brain and energy invested in this project by AIB and SOHA in order to make this project possible, with all the support that we are getting from the builders, from the architect, Mr. Bermelo, thank you very much for everyone's contribution to bringing Aruba to a next level. Each of these projects, each of these endeavors are not only a physical development and process. They bring people together. They bring people to Aruba who at this moment were not part of our society, with new techniques, with new ideas of doing things. At the end of this project, we will not only have a new five-star hospital in Aruba and a much better medical treatment in Aruba, we will have lifted our country also in many other aspects of engineering, of technical improvements to a next level, and that is part of that longer-term vision that we have for Aruba, to bring our community, everyone together to a society that provides a quality of life, and that when families like ours have a very sick patient, they don't have to stand in a hall, but there will be a special place for them to spend those difficult hours. That when you have this very painful circumstance, that someone is in the first aid, maybe just passed away or in very difficult conditions, they don't put you under a tree somewhere to wait and see what will be the news coming out of the first aid. That is the changes that we need to bring for our community, and I believe today we're putting an important step to that direction. So thank you to everyone who is making this difference today, and really your contribution is not only contributing to a new hospital for Aruba, but a new quality of life for our citizens. So thank you very much.